I was 26 years old when I signed a 5-year office lease on a personal guarantee that was 8 offices. And I was still in fellowship. And I was like, I just have to make this work because I have this large monthly payment every month and I can't pay that myself. So I have to make this company work. So in a lot of ways, yes, that's what propelled me and I think led me to be successful faster is I had this kind of fire burning under me.
This episode is sponsored by TherapyNotes, therapynotes.com. Be sure and check them out and be sure and use the promo code Gordon, Gordon, and you can try them out for 2 months for free. Over 15 years ago, when I started my private practice, I had to learn a lot, and most of it the hard way, and I don't think you need to do the same. Hi, I'm Gordon Brewer, a licensed psychotherapist, and welcome to the Practice of Therapy podcast, part of the Psychcraft network of podcasts. Join me in this journey of discovery as we have conversations with other leaders and professionals in both the mental and allied health fields. Join us as we explore both the business and clinical sides of running a private practice. Friends, and welcome to the podcast. This is episode number 373 of the Practice of Therapy podcast. I'm Gordon Brewer, and so glad you've joined me for this particular episode. And glad you're just with me on this journey and just listening into the podcast, whether you're a new time listener, and if you are, welcome. And if you've been coming back for more, so glad you're back, and hope you'll keep listening to the podcast and take time to follow us or subscribe to the podcast wherever you might be listening to it. Looking forward to you hearing from my guest today. This is Dr. Brook Choulet, and Brook is a psychiatrist based out in the California, San Diego area, but she's got several offices across the state there. But one of the things that I really enjoyed talking with Brook about is just about how she built her private practice as a psychiatrist, but also a cash-based practice as a psychiatrist. And one of the things that just really stuck out for me is there's a lot of parallels between building a therapy practice or any sort of allied health private practice to a medical practice like a psychiatry practice. And Brooke's story is really interesting in that she started when she was in medical school building her private practice. So a lot to think about there. And we talk a lot about some of the challenges of building a cash-based practice and also some of the big rewards with that. So looking forward to you hearing my conversation with Dr. Brook Choulet. Before we get to that, though, one of the things that I'd like to let you know about is if you've been listening to the podcast for a while, you've heard me talk about my friend Ashley's store that she started, mentalhealthwaretn.com. And one of the things that we have done or have helped her do is we have partnered with Hope Unite International. And if you'll go back and listen to episode 357 with my interview with Crystal Adams Scott, and she talks about her founding of Hope Unite International, and I think it's a fascinating story, and also just one of just a lot of care and compassion for people that are struggling with suicide and just suicide prevention. But anyway, my friend Ashley and I have partnered with her to do a promotion during the month of March. We're calling it March Madness, which maybe is not a great name for it if you think about it, no pun intended. But anyway, we partnered with her to promote that organization as part of our effort to give back to the community. So with every purchase of this specific collection that Ashley has put together specifically for counselors and therapists and social workers, we'll give $5 for each shirt sold to Hope Unite. And so if you'll go over to practiceoftherapy.com/hopeunite, you can find out more there, and you can also purchase those shirts. And there's a lot of great designs there. So I invite you to go over and do that. So go over to practiceoftherapy.com/hopeunite and check out that collection. And also, before we get to my conversation with Dr. Brook Choulet, I'd love for you to find out more about TherapyNotes, who is the sponsor of the podcast, along with one of the members of the PsychCraft Network.
Hey there, I'm Aaron Potratz.
And I'm Nathan Hawkins. If you don't know us yet, we're the host of the Shrink Think podcast, which bridges the gap between therapists and clients.
The Shrink Think podcast is proudly part of the PsychCraft Podcast Network, focused on helping people live more meaningful and productive lives.
Join us every Wednesday in our engaging, informative conversations and lighthearted humor to help you normalize and demystify therapy for those beginning or continuing their mental health journey.
We discuss everything from understanding styles of therapy to addressing conflict with your counselor, learning about attachment styles, and the fear triangle. We seek to run the gamut of topics to pull back the curtain and empower effective therapy.
If you haven't listened yet, you can find us at shrinkthink.com/podcast and discover other resources, including educational videos and fun swag at our swag shop.
Ready to upgrade your practice from a rusty bicycle to a shiny new sports car? Buckle up, because TherapyNotes is here to turbocharge your journey. It's the comprehensive practice management system you've been craving, equipped with everything you need to navigate patient records, schedule seamlessly, host remote sessions, craft detailed notes, and tackle insurance billing with ease. And guess what? It's your trusty sidekick, available whenever and wherever duty calls. Picture having more quality time with your clients, all thanks to this digital assistant that never clocks out. Here's the kicker. It's Gordon approved, so you can trust it's the real deal. Bid farewell to paperwork headaches and embrace a new era of efficiency and top-tier care. Ready to level up your private practice game? Swing by practiceoftherapy.com/therapynotes and punch in promo code GORDON for 2 months on the house. Enjoy the show.
Well, hello, everyone, and welcome again to the podcast. And I'm so happy for you to get to know today Dr. Brook Choulet. Welcome, Brook. Glad you're here.
Thank you for having me. I'm excited to be here.
Yes, and I think in just the brief amount that we were talking before we started recording, I think we've got a lot to learn from Dr. Choulet. Tell us more about yourself and how you've landed where you've landed.
Sure. So I was born and raised in Cleveland, Ohio. Lived in San Diego all throughout high school. And then I went to a 6-year accelerated bachelor MD program in Kansas City, where you go through undergrad in 2 years, and then you get your MD in 4. And after that, I was dead set on coming back to the West Coast, hopefully back home. And I ended up in Phoenix, Arizona. I met my husband here. I went through adult residency training as well as child and adolescent training here for psychiatry. And then what gets kind of unique about my story is I actually started my group private practice while I was still in training. So I was hiring certified psychiatrists and therapists while I was finishing up my fellowship so that I had a full-time job to transition to when I was done.
Oh, that's impressive to have that entrepreneurial kind of bent to it. That's so cool. Yeah.
Yeah.
So I know. Yeah. Go ahead. Uh-huh.
It took a lot of time and effort. I remember waking up at 5 a.m. to work before my fellowship day started, and then going to bed at 11 to kind of put together all those nuts and bolts of the business end, because there's, like you probably have experienced, there's not a lot of people out there that are willing to mentor and take the time to teach.
Right. Yeah. So I know one of the things that we had said I think it is a great topic is just how private practice is changing for folks, and just the fact that there's so many people going into private practice now, and just how we see it changing. So tell us what you've got on your mind about all of that.
Yeah, and it's interesting that we covered two different coasts, so I'm curious to hear
Hmm.
as well. But at least on the West Coast, it seems like a lot of people, although they are venturing into private practice, are not succeeding as people once were in the past. I remember when I set out to open a practice, people were like, "Oh, just hang a shingle and patients will come." There's such a need for psychiatrists, especially child psychiatrists. And I opened and I'm like, no one's coming unless I kind of put out the effort and make this happen and make this a success. So
Hmm.
what I've been noticing more and more, at least here with the rise of insurance-based clinics and platforms like Alma and Headway, which kind of contract people with insurances, is that the cash pay private practice land is really kind of, at least in on the West Coast, I think kind of cutthroat in terms of can you survive? Can you get enough patients? All that because of these telehealth platforms and all these
Hmm.
insurance-based clinics.
Right, right. Yeah, and I would say it's changing here as well. Although what I'm finding, in at least here where I'm located in kind of the, eastern part of Tennessee, we're in a more rural kind of area, that kind of thing. People are preferring to come in person rather than do telehealth. And so,
Absolutely.
yeah. And so I think that's an advantage to some degree in that we can do that. And then you're right with these kind of tech companies and things like Alma and Headway and that kind of thing, they're kind of setting the prices for people in a way. And so I think I'd be interested to know what your thoughts are around that and how we get around those kinds of things.
Yeah, I'm not sure how your practice is set up, but we're all cash pay and not in
Mhm.
network the insurances. And so I really try to educate people that I hear saying that they want to do private practice because it's easy to say that when you see a clinic succeeding, right? You're like, well, if they can
Mhm.
do it, I can do it too. And what I really try and tell people is if you don't love the administrative side, if that doesn't light you up, if you're not excited by networking events and local recognition and going after local awards and being the top locally, you're really going to have a hard time. And I think as therapists and psychiatrists, we all need to practice what we preach in terms of our own self-awareness, knowing what our strengths and weaknesses are. So it's been an interesting shift because I've seen even people that have been in private practice for over 20 years picking up hospital work now because they're not getting patients like they were before. Whereas our
Mhm.
clinic continuing to get referrals, we're continuing to build, even though we are strictly cash pay and the most expensive in the area, because I put so much effort into local community recognition, community outreach, and being pretty much really well known in different circles of the community.
Right. And so, yeah, and I think that's a key thing to, I think, for people to remember is my practice is still, we're insurance based, and it's mainly because of, I think the decision I made around that was because of the demographics of the
Yeah.
area that we're in. And so certainly depending on the size of the city you're in and that sort of thing, I think it's easier to do cash pay if you're in a larger metropolitan area where you've got people's income is high enough to where that they wouldn't think twice about doing self pay. But I think as much as anything with self pay, the difference between self pay and insurance based is you have to trade the volume that you're gonna be willing to see as far as with insurance based with putting the time and energy and money into marketing and networking and that
Right.
sort of thing. Yeah.
Absolutely. Yeah, I have every Thursday and Friday purely for marketing and networking. And then Monday through Wednesday is my patient care days. And then I travel nationally speaking on sports psychiatry purely just to continue to grow the brand and grow the name.
Right. Right. Yeah. So I guess that's another kind of little tangent we could maybe talk a little bit about is the fact that you kind of diversified the way you do things through speaking engagements and that sort of thing.
Yeah, so about 3 years ago, I entered in the pro sports world and I traveled with an NBA team and I was their consulting team psychiatrist. I worked with the WNBA side too. And I really found that concierge psychiatry and sports psychiatry go hand in hand because a lot of players can't go to an office Monday through Friday, 9 to 5. It's just not possible with their schedules. So I was finding myself going to them, to their homes, to their practice facility on the road. And that really led me to kind of niche myself as the performance psychiatrist. And I trademarked that term and really kind of dug my heels into the sports space. So I think whenever I do private practice consulting and you're in a competitive market like Scottsdale or, Los Angeles, New York, these types of places, how are you different than every single other person around you? And a marketing expert once told me you have to either be the first, be the best, or be different, or preferably all three. So that's something I always keep in mind when I'm consulting with people when they say that they want to open a general therapy practice or general psychiatry practice, is I'm like, I know you're trying to cast a wide net to grab as many patients as possible, but you'll actually do the opposite. Because I run them through the exercise of, let's say I met you at a party. I'm person A and I say, hi, I'm opening my private practice. I'm a psychiatrist. Please send patients to me. I really hope to fill up soon, right? So now you're presenting ambivalence, kind of a lack of confidence and some general psychiatry, like who even knows what that means, versus person B that maybe says, hi, I'm a psychiatrist. I practice perinatal psychiatry. I see women before, during, and after pregnancy. Here's my card. Right? Which one's going to be more memorable? And you need to feed people the types of patients that you want them to send you.
Yes. And that's been something that I try to impress on people because, there's that old cliche, the riches are in the niches, and so being able to make yourself stand out and really kind of establish yourself as an expert in one particular area or another. And I think the other thing is that when people are searching for help, they're searching for people to help them with a specific problem. And the more that you can connect with that specific problem, I think the more it's going to help you in your practice.
Yeah, absolutely.
Yeah. I think the other thing is when you talked about casting a wide net, I bet you get clients that are not necessarily sports related. You get other people too.
Yeah, so for me, I specialize in business, entrepreneur executives, and then athletes and their families. Because in the business world and in the sports world, there are many of the same problems in different settings. You have that high pressure environment. For athletes, it's am I going to get traded? For execs, it's am I going to get fired for making a difference? So it's a lot of similar problems in different environments. So for me, that's my passion, and that's the population I work with. But then in my practice, you're absolutely right. I have other psychiatrists and therapists that are specialized in other areas so that if someone does call the clinic, that we can best kind of pair them to who they would fit best with.
Right. Yeah, that's so brilliant. So as you were building your practice, what were some of the bigger challenges you ran across? Or kind of, I guess, maybe things that you learned about?
Yes, the number one thing was the office space. I knew I wanted to be in person. I was 26 years old when I signed a 5-year office lease on a personal guarantee that was 8 offices. And I was still in fellowship. And I was like, I just have to make this work because I have this large monthly payment every month and I can't pay that myself. So I have to make this company work. So in a lot of ways, yes, that's what propelled me and I think led me to be successful faster is I had this kind of fire burning under me. But on the flip side too, if I had to go back, I probably would have started with that 4 office space and built from there rather than jump into an 8 office space. But there are pluses and minuses to doing it both ways.
Right. Yeah. So, and so as you think about kind of going back to the ways in which our professions are changing, what do you kind of foresee as the future of what's going to happen?
I think there will be an attempt to use AI for therapy. I think there will be an attempt to do that, but I don't think it will be successful. People love relationship building. I've been seeing some of the same people people for 5 years and they send me their prom photos and they send me all these cute things and updates about their lives. And you just don't get that with AI. So yes, I think that there will be an attempt for low cost and easy accessibility therapy in that kind of a model. But do I see in person going away? No, I think that's what people want and crave is connection. And so the other thing to add to my office space story is I signed that when COVID started. So everyone was going virtual and I was going in person. So I think that helped me kind of build a practice quickly. I didn't have kids at the time and my husband worked in the ICU every day. So to me, I was already at risk being at home, and having one person sitting across the room from me wasn't as risky to me as my husband in the ICU with people with COVID.
Right. Yeah.
So I did take that risk and I did open during COVID in person.
Yeah. How do you find the people that you bring onto your staff and that sort of thing? What's that been like for you?
Yeah, I wish I had a better answer for this because this is the truth. I put out one job ad ever for a psychologist, and all the other 9 clinicians all approached me. So I never had to put out job ads and interview. I just was getting people that were interested in what I was doing and they wanted to be a part of it. And I'm not sure what it was, whether it was the branding or the marketing or rates or whatever it was, but people wanted to join. So I always tell people I don't have a good answer for that because I never had to go through it.
Yeah. Yeah. If somebody's interested in private practice and they're thinking about, should I start my own practice versus going to work for somebody that's already got a practice, how would you help them kind of discern that for themselves?
I had that happen recently. Someone interviewed to join our practice and they decided to go do it on their own. And then within 2 months, they're texting me for advice, 4 months texting me for advice, 6 months, they don't have patience. And it's like, I always try and tell people, do you enjoy the admin side? Do you enjoy hustling out there to make yourself known? Do you enjoy branding yourself? Do you enjoy talking about your like specialties and what you can offer people? And if you don't like that, then perhaps working for someone else's private practice is better for you. And so again, it goes back to that self-awareness. People that are in denial or not acknowledging their strengths and weaknesses are going to struggle more than the people who can identify that. So the people that work in my practice, they're like, Brooke, we're so happy you're out there doing this because we don't want to do that. We just want to show up and see patients.
Yes. Yes. And that I could piggyback on that by saying that that's the exact same situation I've had in my practice as well with the clinicians I have, is that they're not really interested in any of the business side, so to speak, of running a practice. Right. And so I think being in private practice is, I think probably a lot of us think about it when we're going through our training and that sort of thing, thinking about, oh, someday I want to be on my own, be in my own practice. But really kind of understanding what that entails, I think, is an important piece.
Right. And that's why I love the environment I've created for the clinicians, because it's like they walk into their own private practice. They pick their hours. They don't want to work Fridays. They don't work Fridays. So really, they have the utmost autonomy to make their own decisions, pick their own patients. I could make more money by requiring certain hours and requiring them to take all the patients we schedule for them. But that doesn't breed happy people. So to me, it's more important that our clinicians have autonomy and are able to feel like they're running their own practice in this group setting.
Right. Yeah. It's an interesting balance there. And I think even with some of the folks that I've consulted with in the past, I think you've got to ask yourself what is your why? And people hear this from me all the time on this podcast, of really looking at what is your ultimate motivation for being in private practice.
Exactly. Yeah. What are you trying to achieve? And if it's autonomy and flexibility, but you don't like the business side, can you achieve that in someone else's practice?
Correct. Yeah. Well, good. Well, Brooke, I'm so glad we got to chat, and I've got to be respectful of your time. tell folks how they can find out more about you and find out more about the things that you offer.
Sure. Yeah. People can visit my website, which is brookchouletmd.com, and that's Brook without an E, or follow me on Instagram at brookchouletmd. I'd love to hear from you.
Yes, I'm so glad we connected, and I hope to have a conversation with you again here soon.
I hope so too. Thanks for having me on.
Well, a big thanks to Dr. Choulet for joining me on the podcast, and I'm so glad that she reached out to me, and I hope that you learned a lot in just thinking about your practice. And, you know, there's a trade-off to some degree whether you decide to have a cash-based practice versus insurance-based practice. You know, for, as we kind of alluded to, in a cash-based practice, you are going to have to devote a lot of time to marketing your practice and really trying to stand out as a unique provider when you have a cash-based practice. Versus if you're insurance-based, it's a little bit easier to get clients, and you don't have to spend as much time on marketing because those clients will kind of come into you from the insurance companies and from referrals and in other different ways. But the trade-off really is that you might need to have a greater volume as a therapist. You're going to have to see more clients because typically insurance rates are lower. So again, you have to kind of think about and discern the trade-off on all those different things. But again, thanks to Dr. Brook Choulet for joining me. And if you'll check out her things, you'll find links here in the show notes and the show summary for that. And also, big thanks to TherapyNotes for sponsoring the podcast. They are who I use in my practice. Couldn't operate without them. They are the leading electronic health record system for mental health providers. They're who I use in my practice. And it gives me such a great return on my investment in that particular platform. They have a patient portal that's second to none, and also their support is second to none. So be sure to check it out. And if you'll use the promo code Gordon, just Gordon, you can try them out for 2 months for free. And also, just finally, thanks for listening to the podcast. I'm so glad that you're with me in this journey. It's hard to believe we're up to 373 episodes. That's quite a lot. And if you think about other podcasts that are out there, not quite been around as long as we have. And it's a big, the reason we've been able to do that is because people just like you that listen in every week and listen to the podcast, and also just give me feedback and that sort of thing on the podcast. And be sure to check out our website, practiceoftherapy.com. I'm constantly adding new resources and new information to that website, and really want it to be a valuable resource to you in your private practice journey. So be sure to check it out. Well, take care, folks, and look forward to joining you again next week for another episode of the Practice of Therapy podcast. You've been listening to the Practice of Therapy podcast with Gordon Brewer, part of the PsychCraft network of podcasts. You can find out more about the other great podcasts in the network by visiting psychcraftnetwork.com. And if you haven't done so already, please visit us at practiceoftherapy.com and get your free private practice startup guide, along with a lot of other great resources and webinars and free things just by visiting. Also, be sure to follow us wherever you might be listening to your podcasts. This podcast is intended to be educational in purpose and is not intended to give legal, accounting, or counseling advice. If you need a professional, find the right person for that.